Hey everybody. So we're gonna. Sorry, I went too far. We are gonna start with chemical burns today. So, like I said, we were gonna start. Like we've already talked about several different things. Chemical burns is something that we do see often in an emergency situation, simply because chemical burns can happen from normal, everyday household things. Um, Now, remember that with chemical burns, we look at things on the pH scale. So, either an alkaline is something that is a really high pH number, and an acid is something that's a really low pH number. So, alkali batteries, the inside of batteries is alkali, and it can destroy the eye in 30 seconds. If you have a chemical burn that splashes in the face, we want to immediately flush it with water for about 20 minutes. And we want to go from the inside corner out. We want to, if it's in the left eye, we want to tilt the head to the left and rinse the eye from left to right. From right to left. Same thing on the right eye. We would lean the head to the right, and we would rinse the eyeball from right to left. Anytime there are any type of chemical burns, we need to call 911. Chemical burns will destroy skin and your eyes very quickly. The difference in a chemical and an acid burn, a chemical burn, an alkaline and acid burn, especially with the eye, is what the eye looks like. Where the eye will look kind of like a milky white, it will lose all of vision. Acids burn will destroy the eye much slower, and that actually can happen in about 30 minutes. So with both of these, the quicker you can start rinsing them, the better that you are to get that out. An acid burn, and the eye will look really meaty red. It will look like the inside of the eyelid, the eye will. Once again, we're going to treat it the same way. We're going to flush it with room temperature water or tepid water, which means room temperature water, from the from the inner corner to the outer corner for 20 minutes while we're waiting on the ambulance to get there. But we are always going to call 911 with any kind of chemical burn, whether it's on the skin or on the face. Acid burns can come from a lot of different things, from a lot of household cleaning products. So we need to look at that and see so that we know exactly whether, when we call 911, what burnt the skin, the eye, whatever's being burned, what product did that. Lots of times they'll also get on the phone with 911. They'll also get on the phone with poison control in case there is something in the house that you could use to reduce that burn or to offset the alkali or the acid. And they'll tell you what to do. But just be sure that you call 911, stay on the phone with them, and be sure that you're flushing the skin or the eye for 20 minutes or until the ambulance arrives. And what you're seeing here on the left is an eye that's been burned with an alkaline. And on the right is one that has been burned with an acid. So they're very, very different looking, but both of them most likely lost vision. Nosebleeds. Now, nosebleeds are something that I have learned while teaching. While teaching, I've learned that people tend to treat these wrong fairly often. Fairly often. There are two types of nosebleeds: an anterior nosebleed, and that's just one that is in the front portion of the nose. It's going to run pretty quickly. It's going to stop bleeding pretty quickly, generally due to some type of trauma. Or just a dry nose, then it can break the vessels in just the vessels really close to the surface in the nose. So those are anterior bleeds. We see those more often. Posterior bleeds are the larger vessels in the back of the nose. Those larger vessels can cause a lot of issue because they're very close to the brain. So if we have a posterior nosebleed, and those are generally going to run down the throat and into the stomach and cause vomiting as well. But generally, those are more serious. An anterior nosebleed, generally we can pinch the front of the nose, lean the head forward, apply pressure for about 5 minutes, and an anterior nosebleed will stop, where that posterior nosebleed will continue to bleed because it's not actually bleeding in the front of the nasal bone. It's actually bleeding back further. So nosebleeds we need to look at. Anytime you have a nosebleed that does not stop bleeding in 10 minutes, we need to have that treated as well. So some causes of nosebleeds, like I said, trauma, getting hit in the nose with anything, high blood pressure, dry air that would dry out the sinuses and the mucous membrane in the nose, sinus infections, allergies, anything that would dry out the mucosa of the nose can cause nosebleeds. Treatment for nosebleeds. So we want the patient to be calm, especially if it's blood pressure related. We want to try to get them in a dark, cool area without a lot of excessive noise, a lot of excessive excitement. We want to kind of help them calm down some. We want to make sure that they sit up straight and lean forward just a little bit, not enough to put pressure on the front of the nose, but just not leaning the head back. If you pinch your nose and lean your head back, what happens is that blood will run down the back of the throat and it will cause you to throw up, and which will just make the nose bleed worse. So when we pinch the nostrils for 5 minutes, we can apply ice to the forehead above the nose, on the bridge of the nose, on the forehead. That'll constrict those blood vessels. But if it's still bleeding after 5 to 10 minutes, they need to go to the doctor. They need to see a doctor. Also, a thing we want to ask patients, if they are taking something that prevents them from having their blood from clotting, or if they're a hemophiliac, if they have a clotting disorder, what we want to do if they have a clotting disorder, or they take something like Coumadin or Warfarin or Agranox, one of those medications that thins the blood, we probably are going to need to go ahead and take them onto the emergency room. Because sometimes what happens when they take those medications, their blood gets too thin and it's unable to clot, so they need help. Also, with nosebleeds, we need to be prepared if it continues to bleed for a long period of time to treat them for shock. So you guys remember that what we do for shock, we call 911. Depending on what's going on with them, we elevate their feet if necessary, and with this one, we could lay them down. We wouldn't want to lay them all the way down, but we could lay them on their side if needed. We need to monitor them related to that blood loss to see if they might need, if their status changes. We need to be sure we're checking that airway, breathing, circulation, level of consciousness. If their level of consciousness changes, we need to be sure we get them some help immediately. Dental injuries. So you guys watched on one of the videos where it talked about dental injuries. If a tooth's completely knocked out, we want to put it in a cup of milk, or we want to put the tooth in a bag with some of the patient's own spit and blood, and then take that Ziploc bag and put it in some ice water. We want to try not to touch the root of the tooth, which will be what comes out of the mouth. And we want to try not to touch the mouth too much, because it can definitely cause damage. We are not going to replace that tooth, but we want to try to get them to the emergency room, because sometimes a dentist will be on call, or an emergency room doctor will be available to put that tooth back in place if it's possible. Not always possible, but sometimes it is. Other dental injuries related to the mouth. If a tooth is just broken, we want to be sure we get them to the dentist as soon as possible. We want to rinse the mouth with water. We want to be sure that we look at the other teeth near it to make sure they're okay. And if they're loose, if anything's going on with them, and then we want to get them treatment. Chest injuries. So chest injuries, there are 2 types. They are open and closed chest wounds. Now, these are the same as open and closed wounds related to fractures or the skin. An open chest wound will literally have the skin broken. So it could be a penetrating wound where ribs are broken and they come through the skin. There may be something stuck into the ribs, like a knife, a part of a tree. If they've fallen out of a tree, it might be a bullet. There could be anything causing that. But chest injuries have an open chest wound has a very specific sound, and it sounds like wind in a tunnel or a sucking sound. It's a very specific kind of wet sucking sound. And if we can possibly do, one of the things we can do is, if there is Vaseline gauze or some kind of way to cover that open wound to keep that air from collapsing that lung further, we want to do that. Then there are closed chest wounds, which are generally the most common types of chest injuries that we see. And that's where we can see bruising, but there's no obvious bleeding or breaking the skin. these injuries are very serious related to chest wounds because they can still have a collapsed lung. They can have broken ribs that could be piercing a heart. It could be near the heart or the lung. That if certain movements or any other impact could cause it to puncture. There's also lots of vessels in the chest wall, so we have to be very careful with chest wounds, and be as gentle as possible and get people help as soon as we can. So blunt trauma to the chest is what we see most causes of serious chest injuries, because there's so many organs under the rib cage. You have your spleen, you have your liver, you have a gallbladder, you have a pancreas, you have 2 lungs and a heart, all in that area. So if people have come into impact in a car accident with a steering wheel, or they sit really close, like me, I'm really short, so I sit really close to the steering wheel. The airbag could potentially do damage to someone who's short. It could do damage to their chest. Also, fights, accidental. I mean, I had a student, or a young student, freshman student, come in from a baseball game. They had accidentally gotten hit in the dugout with a bat, and it broke a couple ribs. So there are many things that could happen that could cause a chest injury. We want to first treat it and find out what happened. If it's due to some kind of illegal activity, we want to report that if we need to, but we want to be sure that we try to find out what happened and try to keep the patient as still and as comfortable as possible so that we can prevent any further damage. Penetrating chest wounds, those can be caused by anything that would go through the skin, any kind of instrument, any kind of related to any kind of fall. People fall on things all the time. They'll be on the house working on something, and I've seen a guy fall on a gutter. I've seen them fall on a branch and have a branch sticking out of their chest. Hammer. I had a guy have a hammer sticking out of his chest once because he was working on his house and he fell. So things happen. We just need to be sure that if something is sticking in the body, we do not remove it. We just try to keep the patient calm, keep the victim calm. If we need to wrap something around it to keep it from moving and keep it in place, we want to try to secure it in place if we can with as little movement of the object as possible. Crushing injuries we generally only see in industrial accidents and car accidents. And that would be when the body is squeezed under a piece of equipment, a vehicle, in some kind of malfunctioning equipment. Then it can actually cause the spleen to rupture. It can cause damage to the liver. It can cause a lacerated liver. Many things can happen when there's a heavy weight or some kind of squeezing action going on the chest to where it puts an excessive amount of pressure. Those are very, very dangerous. All of these kinds of chest wounds are very dangerous because we have so many vascular organs in the chest. Signs and symptoms of chest injury: shortness of breath, open or closed wounds, chest pain, deformity of the chest. One side of the chest will be rising and falling and the other won't. One side will look flatter or misshapen. When that happens, they're not going to be perfusing as much oxygen. They're not going to be circulating as much oxygen, so their skin color is going to change. It's going to get really pale, it's going to get a little bluish, and then they're going to get even more pale looking. We need to make sure that we are watching to see what's going on with that patient and monitoring their airway, breathing, circulation, level of consciousness. And then if there's an open wound, we're going to hear that sucking sound. Once oxygen saturations get low enough, patients will go into shock and we have to treat them appropriately. Patients also sometimes will cough up blood. So if they're coughing up blood, that's also a reason to be sure that they get treatment just as soon as possible. Treatment for closed chest wounds: airway, breathing, circulation. Call 911. We're going to need to get this patient help or this victim help. We want to sit them in a sitting position unless there are other injuries that prevent that. So that way there's less pressure on their chest. If they're laying down, it's harder for them to breathe. So we want to have them sitting up as much as possible unless they have some kind of pelvic fracture, leg fracture, or something like that. We want to try to immobilize the ribs, put an ACE bandage around it if possible, give them a pillow to hold around them, but give them as much support as we can. And we can do a sling with a swath like we saw earlier when we looked at that triangular bandage. And but we don't want to make the chest dressing so tight that it makes it hard for them to breathe. So it needs to be supportive but not tight. For an open chest wound, we want to seal it as quickly as possible. So saran wrap, a plastic bag, and some tape over it, something large enough to cover and also tape around to prevent air from coming into that wound. This is life-threatening, and you need to call 911 immediately. Patients can have lots of issues, so you need to be sure that we get them help as soon as possible with any kind of chest wound. Embedded objects in the chest, like always, we do not remove it. We stabilize it, and then we get them help immediately. We don't pull anything out of we don't pull any penetrating object like a knife or a stick or anything, ice pick, anything that would be sticking into the body. We don't remove that because we don't know if it's piercing, if it's pierced an artery, and when you pull it out, they have an arterial bleed. So we just leave it in place, keep it secure, and get them help as soon as possible. Another thing that we see often are abdominal injuries. Abdominal injuries can be open and closed. Once again, open injuries are from some kind of foreign body entering the abdominal cavity. Closed injuries are usually due to blunt force trauma, due to being hit, run over, falling and impacting some kind of really firm object. Just remember that like the chest cavity, the abdominal cavity also has a lot of vessels, a lot of blood vessels there. And so you have your descending aorta in the abdomen. So you can do a lot of damage. There can be a lot of internal injuries and internal bleeding that someone that they need treatment for immediately. So causes of abdominal injuries: being impaled on objects, penetrating injuries where something actually is sticking into the body, knives, pins, ice picks. They may have when the airbag deployed, it shot a piece of the dashboard into them. I mean, anything can happen. So we want to make sure that we know kind of what caused that injury and try to help it as much as possible. Closed injuries are usually due to falls, motor vehicle accidents, or personal altercations where people get into a fight and they get hit with objects other than sometimes just fists, but lots of times other objects. Signs and symptoms of issues related to an abdominal injury: abdominal pain, cramping, nausea, and vomiting. Sometimes they vomit up blood. They're very careful not to want you to touch their abdomen because it's painful. Also, the abdomen will feel really firm. If there is blood in the urine or the stool, if there's open and you can see inside their abdomen, that's very serious. Also, they're going to have signs and symptoms of shock due to an excessive amount of blood loss. Treatment: so ABCs and call 911 immediately. Try to keep the patient warm because when someone bleeds, has excessive bleeding, they get cold very quickly. So we're going to try to keep them in a comfortable position and as warm as possible and as calm as possible. We want to keep their heart rate slow so it doesn't increase the bleeding. We don't want to give them anything to eat or drink because most likely they're going to need to go to surgery. Also, we don't want to put anything in their body that could cause them to vomit because that increases the abdominal pressure. Any kind of area that is open. If you can see organs, if you have gauze and saline, we want to try to take that and wet that gauze and put that over the any organ that's exposed. That way, they're less likely to have other damage. And then, once again, if they've been impaled on any object, we don't remove it. We just let 911 know what has happened. Now, fractures are something you guys are pretty familiar with because we've done bones already. So fractures are something that'll just be a review for you guys. But a fracture is defined as a break in the bone cortex. So it's an actual break in the bone. There are two types, just like most wounds: open and closed fractures. A closed fracture is not penetrating or not breaking the skin, and an open fracture would be one that is poking through the skin. Dislocation is when a joint has been displaced. So we see a lot of shoulder, elbow, and hip dislocations in the emergency room. Sprains and strains. So a sprain is defined as a temporary dislocation of a joint, usually involving ligament injury. A strain is more of a muscle pull. So a strain is where you actually slide a joint further out than it needs, and it hyperextends or overextends the ligament, causing swelling and all that kind of stuff. A strain is just when you have overutilized a muscle, and generally does not involve ligament damage. Causes of bone and joint problems. Sporting injuries are number one with bone and joint problems in school-age children. Those are the things we see the most. Second, we would see motor vehicle accidents as the next most common sign of joint injuries. And those can be four-wheeler accidents. They can be dirt bike accidents. They can be go-kart accidents, all those kind of things. Falls, and then altercations. We see a lot of broken bones in older people related to falls in the emergency room. Signs and symptoms of bone injury. Lots of pain. Bone injuries of any kind are very painful. Those of you who have had a high sprain or a third-degree sprain, or some significant or broken bones or anything like that, it's very painful. You're going to see immediate swelling and bruising at the site. You're going to see deformity, and sometimes they're unable to, or they have excessive movement and no control of the movement in that area. Crepitus basically means it's a grating sound when a broken or a damaged area, you try to move that, you'll kind of feel a grating sound. With an open wound, you're going to see the bone protruding through the skin, and we want to get anything like that help as soon as possible. It needs to be stabilized. We need to try to keep it splinted as much as possible. And any kind of open fracture needs emergency treatment because of the risk of infection along with the risk of bleeding. So treatment, as you can see throughout, we're always going to manage ABCs first. We want to remove any clothing around a fracture just so that it's easier to see what's going on with that fracture. Also, if we need to splint it, we're able to splint it, and they're not going to have to remove the splint immediately to try to get the clothing away. We don't want to touch a protruding bone. If the bone is sticking through the skin, we don't want to touch it. We don't want to try to put it back in place, but we do want to try to control bleeding from around the bone if we can. If we splint that area, put two pieces of something that's firm on each side, and do a loose dressing around it to hold that splint in place, then we want to make sure that the skin stays pink. They're able to move it, and they have sensation, and it's not getting cold above or below. And we want to frequently check that pain, movement, and sensation related to that injury, so that we're aware because swelling will continue even after you put a splint on. They're still going to continue to have swelling, so we want to be sure that we pay attention to that and we check that frequently. Treatment for muscle injuries, we're going to do something called RICE. Rest, ice, compression, and elevation. That's what we do for muscle injuries. So we're going to elevate it. We're going to elevate whatever is swollen whatever is the affected areas to reduce swelling. We're going to apply light compression with an ACE wrap, but not too tight. Make sure that they have movement, their skin stays good and pink, and they have good circulation. We want to apply ice for the first 24 to 48 hours. And once again, just staying off of it, resting it, using crutches, whatever we need to do to keep that. After 48 hours, we can apply heat to help the bruising and everything else go away. Now, if it is a bad enough sprain, if you are unclear whether it is a break or a sprain or a strain or a muscle injury, then we need to go ahead and send that person onto the emergency room for x-rays. And sometimes people will have a minor break and it won't show up the first day due to swelling, and we need to take them back a week later for the area to be x-rayed again, just to make sure that there's not a break if pain and swelling and all of that continues. Spine injury. So we've talked about spine injury some. we've talked about making sure that we keep the patient as still as possible. We support the head and neck to keep them from moving. So we want to be sure that we are watching what's going on with any kind of spine injuries. Some of the causes of those spine injuries: motor vehicle accidents, falls, diving into water that is too shallow. So that's one of my things about lakes is sometimes you don't know how deep the water is, and people will dive off of a boat and end up causing themselves back and neck injuries because of that. So always want to be careful with that. I have had bronc riders, bull riders, people that rope, people that different a multitude of rodeo people that have come in with spine injuries from falling, being bucked off, thrown onto a barrel, all kinds of things. And then gymnasts sometimes have issues related to falls. So signs and symptoms of a spine injury, you got to know what happened. Anything that might suggest a spine injury, we're going to treat it like a spine injury. And if you don't know whether there's a spine injury or a neck injury of any sort, then you're going to assume that there is one. We're not going to risk it. If we think there's a possibility, we're going to go ahead and stabilize that spine and neck. Lots of times people who do have some kind of spine injury, they'll have numbness, tingling, weakness in their legs or arms. They'll be able to stand for a second and then may fall down. They don't have good control of their limbs or their bowel or bladder, depending on the location. They're going to have pain over the spine specifically. Also, if the spinal injury is high enough, they may have difficulty breathing. They may not be able to cough. So you just have to be sure that you're paying really close attention if that person is able to talk to you. If they are unconscious, we always assume there's a spine injury. Treatment: airway, breathing, circulation with the jaw thrust remover we saw on the second day. We're going to call 911. We're not going to allow the patient to move unless they are in imminent danger, which means they've been ejected from a car and they're in the middle of the road. And if they stay in the road, they're going to get run over. That would be an example. We want to keep the patient as warm as possible. They possibly could go into shock related to a spine injury, because remember, when you have a spine injury, the brain is not able to talk to the rest of the body. We're going to try to keep the head and neck aligned. You can use a rolled blanket to wrap around the head in a horseshoe shape. And we're going to secure them to a backboard as soon as we can, or to something firm, and keep them as still as possible. Splinting. Remember that a splint is a supportive device. It's applied to immobilize a fracture or restrict movement of an injured body part, just so that until we can get them help. Also, splinting helps prevent further damage to limbs, further damage to tissues, further damage to organs. In many cases. Types of splints. So you're going to see different types of splints here. We use pillows often for splinting, especially of the abdomen. They also have air cushioned or air pillowed splints. A lot of you have had sprained ankles, and you may have had an air splint for your ankle. That's considered a pillow splint. Then there's going to be rigid splints that are padded, but they're very firm. We use those a whole lot for splinting arms, legs, things like that. And then there's professional splints, and those would be like traction, which you see down there on the right. Those definitely are padded like a vacuum splint that we could put around someone with a serious injury. That generally they're only carried or they're only housed in the ambulance. Other ways we can create splints. So you can use sticks. You can use a pillow. You can buddy tape things. Not necessarily arms, but fingers. You definitely can buddy tape. Toes, you can definitely buddy tape. You can use newspaper. You can use magazines. You can use anything that is firm. I even saw a patient come in one time that their grandma had actually put two paint sticks together. 2 paint sticks, one on each side of their arm, to make a splint for a broken wrist. So anything that's firm and that you can keep an area aligned, that's definitely what you want to use. So things to know about splinting for sure. We want to make sure that we apply the splint before we move the victim. We don't want them to be able to cause more damage by moving them. We want to make sure that there's always, we're doing we're checking for pink skin that's warm, that they are able to move it above and below the splint, and that they are able to feel above and below the splint, that we haven't cut off the circulation or the nerve impulses to that area. We want to secure it with rolled gauze or torn sheet. We can use torn t-shirt. I've used quite a few different things in the past to secure things in an area where I didn't have I didn't have the best splinting equipment. So I've used, like I said, torn sheets. I've used a torn t-shirt to attach that splint and keep it in place. You want to make sure that when you use a splint that fingers or toes are exposed so that we can make sure circulation is good. We don't want to, though. We want to splint around the way the arm is deformed. We are not doctors and we cannot set a bone. So we want to splint it for support, but not to straighten something out, not to try to put it back in place. Open fractures, we want to cover with a clean, sterile dressing if possible, and control any bleeding that there might be. Hands and fingers, they should be placed in a position of function. So if we're going to if maybe it's a wrist and we're going to go ahead and we're going to maybe put a rolled wash rag in their hand so that they can keep their fingers round, and then we splint under the wrist. We want to remove any jewelry, clothing, socks, shoes, anything around the injured site, simply because that is going to continue to swell, and if you leave jewelry in place, it has to be cut off and it's painful. Also, clothes can constrict circulation and nerve impulse, so you want to be sure to remove any article that doesn't have to be there. We want to frequently check for pain, for pink skin, the ability to move, and sensation. We want to elevate an arm or a leg above the heart if possible, and apply ice to a closed fracture if possible. We don't want to put ice directly on the skin. We always want to put it, on top of the dressing if possible, on top of a shirt, something between the skin and the ice itself. Okay, let's see. All right, I'm going to stop there for today, and tomorrow we will talk about moving victims. All right, everybody have a great day, and I'll be back later.